Good morning, everyone. I hope you're all well. Before we get started, for anyone who may be new to the team, my name is Jenna Coles and I am one of our psychologists. So in today's meeting, I wanted to discuss a referral I have received from a GP regarding a 9.5-year-old male, Dwayne, who is presenting with behavioural problems and learning difficulties, specifically poor reading, writing, spelling, and comprehension. These concerns are raised by both his parents and school teacher, and his parents mentioned they noticed a change in Dwayne's behaviour at around 8 years of age. Regarding behaviour, the biggest concern is Dwayne's reactivity and defiance, which is seen in both home and school environments. Dwayne is said to have an explosive temper, and he is prone to verbal and physical aggression towards authority figures, particularly when getting into trouble. Dwayne is described as being difficult, stubborn, argumentative, and does not like doing what is asked of him. He's also quite playful with dangerous objects and has had an incident at school where he was caught playing with scissors. Emotionally, Dwayne appears to be dysregulated and is often angry and irritable. When asked to do things, his response is typically reactive. From his background information, we know Dwayne repeated kindergarten and received average grades. He is currently in Year 3 and now performing poorly across all subject areas. Dwayne refuses to read and write, and when he does, his handwriting is extremely messy and it's filled with spelling mistakes. Regarding his family structure, Dwayne lives at home with both parents. However, there's no mention of whether he has any siblings. There appears to be difficulties in parenting practices. His parents have tried talking and reasoning with him, though that has been unsuccessful. So then they resorted to making threats and promises in order to gain compliance from him. In terms of socialization, we know Dwayne has difficulties forming and maintaining friendships. He has no close friends and prefers playing on his own, unless he is with his cousins, of which he does enjoy spending time with. In the classroom, Dwayne's interaction with peers tends to be vindictive and of annoyance rather than of a friendly nature. Dwayne's speech and language appear to be normal and he's able to articulate and pronounce his words quite well. Motor skills are okay, however, his handwriting is quite messy, which may indicate some issues with fine motor skills warranting further investigation. Cognition-wise, Dwayne is said to have a good memory and does not easily forget things. There are indications of impairment in attention, as he's only able to pay attention to things that interest him. So learning, obviously there are difficulties in verbal and written language, and visual processing. He does wear glasses for short-sightedness. However, there has been no formal testing done prior to this referral, so further investigation into this is warranted to get a greater cognitive profile and understand what's really going on with Dwayne. Dwayne's medical history shows no issues during birth and no history of serious illness or accidents. He is, as mentioned before, wearing glasses, though it's unknown when this problem occurred, which I feel this should be followed up on to see whether this is a potential factor for the onset of his learning disabilities and behavioural problems. Finally, there is no history of mental illness and mental retardation or learning difficulties in both his immediate and extended family. So that is all of the background information, and based on this knowledge, it appears there are characteristics of oppositional defiance disorder or ODD, with the possibility of co-occurring attention deficit hyperactive disorder or ADHD. Reason for these provisional assumptions are presenting symptoms associated with both conditions. So specifically Dwayne's anger, irritability, defiance, lack of remorse and aggression towards authority figures. And these behaviours are obviously occurring across multiple contexts, and that is associated with level of severity of ODD. With ADHD, we see the inattentiveness, the disruptive nature, and apparent learning difficulties. The research does also show us that Dwayne is at a greater risk of developing ODD, as it tends to appear more frequently in boys. The same with ODD, as that appears, 4 times more likely in boys than it does girls. We can see his social interactions are limited and he has difficulties making friends. This may be a potential factor maintaining these poor behaviours, as he lacks the awareness and ability to appropriately communicate with peers rather than through annoyance. Dwayne shows aggression towards authority figures, again, possibly triggered by getting into trouble and being asked to do things he does not want to do. This also does tie in with Dwayne's temperament, as he is described as being difficult and stubborn. And again, from literature, we know that this difficult and stubborn temperament potentially increases the risk of developing ODD. There also appears a breakdown in parenting practice. So whether the parenting style has exacerbated Dwayne's behaviour. We know from social learning theory that children tend to mirror what they see. So whether parenting style has influenced his aggressive behaviour is something that we should also look at further. Whilst there are indications of ODD and ADHD, there are still follow-up questions I would like to ask. I would be interested to gather a bit more of a timeline from when these problems all started occurring. We've got a bit of a case of the chicken versus the egg, sort of which problem came first and did one affect the other. So was it the learning difficulties that triggered the poor behaviours to mask his impairment? Or is the poor behaviour and inattentiveness that has made it difficult to him to concentrate in the classroom and learn, and therefore he's fallen behind and has caused these learning difficulties? I'd love to also determine whether his eyesight problem started and whether this was detected straight away. So obviously if a child cannot see clearly and things are blurry, this may have had bearing on his reading and writing and spelling difficulties. Finally, I'd love to gain clarity on Dwayne's cultural background to determine whether there are any practices here that have influenced his learning or his socialisation skills. It is also good to know for when conducting assessment and commence intervention that we are engaging with Dwayne and his parents in a manner which is culturally responsive and appropriate to get the best outcomes for Dwayne. So where to from here? Firstly, given Dwayne's age, ethically we need to gain consent from his parents in order to proceed with any assessment and intervention. And of course, ensure that any information gathered is stored safely to protect privacy and confidentiality. I recommend completing a child intake assessment in which Dwayne's parents will complete via an interview. So this will help gather information required regarding Dwayne's behaviours, emotional problems, mental abilities, speech and language, etc. And it's just an overall good chance for his parents to raise any concerns they may have and get more details about him in greater depth. So I probably would suggest that his parents do these individually and without Dwayne in the room, so they can be a bit more honest and transparent and we get a really good idea of what's going on. I would also suggest with a possible ADHD, we look at some form of social, emotional and behavioural assessment to be completed with Dwayne's parents and his teachers. Something like the Connors 3 assessment may be a good option, as this does not diagnose but gives an indication of whether the individual has ADHD. I also recommend a standardised intelligence test to identify Dwayne's learning profile and signs of any specific learning difficulties, possibly such as dyslexia. So despite there being no family history of learning difficulties, this will help determine whether the difficulties he is experiencing is due to a specific learning disability. Perhaps a social worker may be able to go into the home and observe parenting and suggest avenues for his parents to gain support if they are not coping. So we want to be working with the child rather than against, and that may help reduce a lot of the behavioural symptoms we are seeing in the home environment. And finally, given Dwayne's lack of social skills, we may need some form of social functioning assessment, possibly by an occupational therapist, to determine whether there is a lack of understanding of others' emotions and his own ability to regulate himself. So that is the case of Dwayne. Thank you so much for your time, and we will reconvene in a couple of weeks with an update on where we are at. Have a great day, everyone.